Millions of people routinely take common medications like antihistamines, cold remedies, and metformin. But what if these seemingly harmless drugs could lead to serious and sometimes dangerous side effects? This is a critical health alert that demands attention, especially for older adults who are often prescribed multiple medications. But here's where it gets controversial. Many patients aren't fully informed about the potential risks and interactions between these drugs, raising urgent questions about how medication safety is communicated and managed. Health professionals are increasingly warning that certain combinations of medications, many taken daily by the elderly, can cause severe behavioral symptoms and increase the risk of accidents, falls, or even life-threatening complications. According to research by the Nuffield Trust, only 41% of patients say they were definitely made aware of side effects associated with their medications. Alarmingly, around 30% say they weren't told anything at all, despite the fact that nearly 2 million people aged over 65 take 7 or more prescribed medicines each day. Lee Cartwright from Mobility Solutions Direct brings to light the most concerning drug combinations everyone, but especially older adults, should watch out for. 1. Heart medications like furosemide and indapamide. These drugs, used to treat heart failure or high blood pressure, can cause sudden and dangerous drops in blood pressure if the patient becomes dehydrated. For example, if someone taking these medications begins to sweat excessively, their blood pressure could plunge sharply, causing dizziness or even falls. Older adults, who often have a reduced sense of thirst or other health issues, face particular danger. 2. Metformin for type 2 diabetes plus furosemide. Metformin helps control blood sugar but can lead to lactic acidosis, a rare yet serious condition, especially when a person is dehydrated. Symptoms include extreme fatigue, muscle pain, nausea, and cramps. When combined with furosemide, a medication also affecting fluid balance, the risk intensifies, particularly in older adults who are more prone to dehydration and balance problems, ultimately increasing their fall risk. 3. Antihistamines and benzodiazepines. Many hay fever treatments contain antihistamines, which can cause drowsiness. If someone is already prone to unsteadiness, adding benzodiazepines, drugs prescribed for anxiety or sleep issues, such as temazepam or diazepam, can amplify mental confusion and sedation. This mix raises the likelihood of falls or accidents, a serious concern for seniors. 4. SSRIs, selective serotonin reuptake inhibitors combined with decongestants. SSRIs, commonly prescribed for depression and anxiety. Examples include fluoxetine and sertraline, sometimes cause drowsiness, slow reaction times, and confusion. When paired with decongestants found in cold medicines like pseudoephedrine, these drugs can disturb blood pressure, sleep quality, and mood. This cocktail can lead to unusual or erratic behavior that is distressing for both patients and caregivers and often goes unrecognized. 5. Multiple medications taken together. Mixing medications like SSRIs, sedatives, and antihistamines can significantly impair cognition and coordination. This is especially problematic for individuals with Alzheimer's or dementia, as the compounded side effects deepen their vulnerability. They may misinterpret their surroundings, take unnecessary risks, or fail to respond appropriately to injuries, sometimes with tragic consequences. What should you do if these side effects appear? Lee Cartwright offers valuable advice. If you notice sudden behavioral changes, such as irritability, aggression, altered personality, struggling to concentrate, or rambling speech in someone taking medication, take it seriously. These signs may signal that they're at increased risk of accidents or falls. He suggests practical safety improvements around the home to reduce hazards, removing or taping down loose rugs, ensuring stairways and hallways are well lit, placing non-slip mats in bathrooms and kitchens, and generally enhancing visibility. Small changes like these can significantly improve safety and help older adults maintain their independence longer. This issue stirs debate over patient education and medication management. Should healthcare providers do more to thoroughly inform patients about these dangerous interactions? Are current prescription practices adequately tailored to protect the elderly? And what responsibilities do patients and carers have in monitoring and responding to side effects? We want to hear your thoughts. Have you or a loved one experienced unexpected side effects from common medications? Do you believe enough is being done to warn patients about these risks? Join the conversation below and share your experiences or perspectives. Sometimes the most effective safety measures come from the collective wisdom of those affected.